When I am increasing and decreasing the speed while walking, then it is change of pace. If I am walking in this manner, the same constant speed, that will not create pain. But if you ask me to just walk fast and then slow, that will create pressure, extra pressure on the joints, and which will create pain. So these are the signs or symptoms of gouty arthritis. There is an enzyme called xanthine oxidase, which is responsible for production of uric acid. Most of the medication are targeted towards this particular enzyme. We try to inhibit xanthine oxidase in order to reduce the production of uric acid. Number one. Number two, since it has accumulated in our body, by only reducing the production will not help. We have to increase the excretion process too. So we need uric agents. So there are two types of drugs which are targeted to reduce uric acid in the body. One, inhibitor of xanthine oxidase. Number two, uric agent, which helps in excretion, to increase the excretion of uric acid from the body. Right? So now we will see each one. Gout, we can, depending on the cause, we can classify primarily in two classes: primary gout and secondary gout. Primary gout means which is related to the purine catabolic pathway defects only. They are called primary gout. Enzyme defects, which is related to purine catabolic pathway only. That is the primary defect, primary gout. Secondary gout means the production is somewhat okay, but there is a problem in excretion of uric acid, or the normal production has surplussed due to production of other ectopic reasons, not related to primary catabolic pathway of purine, but some other reason purines are being generated more and they are catabolized more. Now, two things have been given here. Number one, deficiency of HGPRTase here. What is written? Partial deficiency, which leads to overproduction of uric acid. Now, here you see complete deficiency. Complete deficiency. Complete deficiency means in either way HGPRTase is helping to reduce uric acid. How? Try to understand, then only I will explain later on. How HGPRTase help in reduction of uric acid. Bolo? Yes? Deficiency leads to overproduction of uric acid, right? That means hyperactivity is good? Yes or no? Nothing more or less is good for us. Nothing more or less. HGPRTase, hypoactivity, dangerous. Hyperactivity is also dangerous. Why? In both the cases, it will generate more and more nucleotides, and that will have no use. Excess is being produced. So that will undergo catabolic pathway and will produce more and more uric acid. So if it is having deficiency of HGPRTase, then excess of nucleic acid goes for catabolic pathway. If it is hyperactive, then they produce more and more nucleotide. Again, that is excess it will go for catabolic pathway. It will produce more and more uric acid. Correct? So problem arises that it's not only synthesis but also excretion should be taken care of. What is that? See, secondary gout are mostly related to overproduction of nucleic acid, leukemia. Means what? Overproduction of nucleic acid, new cells are being generated due to cancer. So cancer is a reason when uric acid is elevated. Uric acid is a potent antioxidant. So low uric acid is good for your health or high uric acid is good for your health? If I ask you, name one endogenous antioxidant, the best answer is endogenous. Best answer is uric acid. So having high uric acid is good or bad? Huh? You are having good antioxidant, you don't have to buy vitamin C and vitamin E from outside. You are producing so much of uric acid, you are having cancer, you are producing so much of uric acid, you are protected, well protected from oxidative stress. Is it good or bad? Sighting of very low uric acid is a symptom or sign. Sighting of very low uric acid is a sign of increased oxidative stress. Increased oxidative stress. Remember? But the reverse is not true. This is biology. Reverse is not true. That doesn't mean you take uric acid in a tablet form and lower your oxidative stress. Correct? So, citing low uric acid is a sign of oxidative stress. It means your body is generating more and more free radicals. Fine. Okay. What is the other reason? Chronic renal failure. Slowly, kidney is losing its function. So, it is unable to excrete uric acid. Moreover, by the time the person has grown up and he has started taking certain things which are not normally found in our diet list. Say for example, alcohol. Do you ever start your day with alcohol? There are few people who start their day with bit of alcohol. There are many, right? But usually it is not a part of our diet chart. So these people, due to this alcoholism, the detailed alcohol metabolism will be taught to you next week probably. But this alcoholism causes generation of lactic acid. This lactic acid compete straight away. They compete with uric acid for excretion. So kidney prefer excreting lactic acid over uric acid. তাহলে কি কিডনি ল্যাকটিক অ্যাসিড এবং ইউরিক অ্যাসিডের মধ্যে ল্যাকটিক অ্যাসিডকে এক্সক্রিট করতে প্রেফার করবে দেন ইউরিক অ্যাসিড। তো কি হবে? The production of uric acid is same, but excretion is reduced. So what will happen? It will accumulate, right? Can you name any other condition in which lactic acidosis is seen? From the knowledge so far you have got von Gouty's disease, very good. So type 1 GSD is one such disease where there is lactic acidosis due to hypoglycemia. So that leads to again reduced excretion and increased accumulation of uric acid. Now problem is not that much. Problem arises when the person in whose body it is taking place is getting older, at least has crossed the middle age, 50 or plus, then their body, the temperatures of the extremity are much lower than compared to a 25-year-old boy. Right? And that increases the risk of accumulation and sedimentation in the form of urate, sodium urate crystals. Based on symptoms, as patient arrive in the OPD or to your chamber, wherever you are sitting to advise the patient may come with either of these conditions. That was the reason behind primary and secondary. Now, this is based on symptoms, whether the symptom is acute or chronic. Acute means the patient will come and complain that sudden onset of pain. Suddenly, out of nothing, the pain will start. And what is the nature of the pain? The pain is usually starts from the big toe, পায়ের বড় আঙুল, বুড়ো আঙুল থেকে শুরু হয়, from the big toe, and the nature of the pain is like as if some monster is biting the joint. মানে এটা কামড়ানো ব্যথা বলবে. Patient will explain the pain will like this, as if something is biting. This kind of pain will come. Correct? So very typical. Practical বসি. Then again, if they drink some water or something like that, after some time it will go off. Now, this process, if not answered properly, not treated properly, then they lead to this chronic condition where accumulation of urate crystals in the joint will cause permanent damage to the cartilages. You might have seen some people, they undergo knee replacement or hip replacement or joint replacement due to this damage to the permanent damage to the cartilages or bones. Why? Due to this arthritis. Now, this arthritic condition can be of two types. One is osteoarthritis like this, another is rheumatoid arthritis. That we will not discuss here. That's an autoimmune disease. We will not discuss here. We will discuss about the osteoarthritic changes. So, what are the osteoarthritic changes? The cartilages and the bones will show accumulation or deposition of sodium urate crystals, which will make them coarse, rough, and hence it will create problem. This is a classical picture of gout. You will find in many medicine, book of medicine. Classical picture of gout. The first time they describe the pain of gout like this, as if some monster, very small monster. Monster doesn't mean always big as dinosaur. They mean very small, like monster.com. Have you ever seen monster.com ever? So monster can be very small. So a small monster is biting. What is there in this picture? What are other abnormal things you find in this picture? There is a hint in this X-ray also. What is that? Swelling, correct. See, this swelling is called tophi. Particularly this kind of swelling is called tophi, T-O-P-H-I. Accumulation of urate crystals in the joints, like this. So tophi is a painful swelling, very hard. Drugs used. You may give painkillers like non-steroid anti-inflammatory drugs, NSAIDs, which are nowadays almost banned. Why? Because it causes gastritis. So NSAIDs, when first discovered, it was like a magical drug. Magical drug. You give NSAIDs and everything is cured. No pain, nothing. But problem is, in the long run, most of the people, they develop gastritis. So, they replace NSAIDs with non-NSAIDs painkillers. What is that? Paracetamol. So, paracetamol was first discovered as a painkiller. Later on, they found it also reduces body temperature, hypothermia. Means, suppose you are having 37 degrees Celsius, if you take 2 paracetamol, your body temperature will not become 35. No. If you are having 39, they reduce it to 37. So, the use in hypothermia came as a side effect of paracetamol. Anyway, then in chronic gout, when you have a lot of time to invest slowly on the patient, you give these kind of drugs. What is that? Allopurinol. These are inhibitor of xanthine oxidase. Write down. It forms alloxanthine. Allopurinol forms alloxanthine with xanthine oxidase, which then block the active site of xanthine oxide and thereby reduces the further production of uric acid. It competes what? Alloxanthine, not allopurinol. Alloxanthine compete with that of uric acid for the same active site of xanthine oxide, and hence they reduce the production. How? It is not a reversible process. Once they are fit into the active site of the xanthine oxide, they are fit forever. You cannot release them. So, they actually literally destroy the whole enzyme molecule, and that is why they are called suicide inhibition. They are called suicide inhibition. Means once they sit in the active site, they permanently damage the whole enzyme molecule. It is not reducing the production of enzyme activity or reducing the production activity of the enzyme. No. Destroying the enzyme molecule as a whole. Fine. So, number of enzyme molecule decrease, so number of products also decrease. What is that? Uric acid will decrease. Another is, so very commonly you have found a drug called Febutas, might be using in your family, many people. So, that is from febuxostat. Right. So, febuxostat is also something which reduces the production of uric acid. Probenecid and sulfenpyrazole, they are called uricosuric agent, means they help in excretion through urine. So, these two will reduce the production, these two will increase the excretion. So, you will get a time to cure the patient slowly. Right? This is a way of treatment. Just remember these names, at least allopurinol as suicide inhibitor and probenecid as uricosuric agent. Very often these are asked in MCQs or short questions. Particularly these drugs names are asked. Now I give a case study here. Let's go through it. The normal level of uric acid in blood is different in male and female. Obviously males have higher, say around 5 to 6.2 or 5.5 to 6.8, 5 to 6.8 like that. It should be below 7 males. Females, it should be below 6.5. Right. So, a patient comes with this kind of condition. What is the condition? See what he has eaten. Last diet, liver fry, right? Kaleja fry. Huh? With what? With what? Okay. So, he has taken alcohol along with liver. So what he has taken? He has taken something which will reduce excretion of uric acid, alcohol, and he has taken liver, which is a store of nucleotides. That means overproduction of uric acid. So for the time being, in his body, it is producing more and more uric acid, and due to alcoholic nature of the diet, is unable to get rid of it. So what will happen? It will suddenly shoot up the uric acid concentration in the body. It's called acute gouty attack. So he will come to see you. You will understand what has happened. You will ask what he has taken. Okay. So what you will advise not to drink alcohol, and take less meaty substances so that its production comes less. After some time, if you measure, then the value will come down, uric acid. That means he is having acute gouty attack. If it doesn't come down, that means it is having chronic gouty attack. After changing lifestyle, if uric acid concentration does not come down, that means he is having chronic problem. His body has acclimatized with high level of uric acid. Sometimes we get 9.8, 10.2 uric acid people, but without any complaint of joint pain. Why? Because he is a chronic patient. His body has acclimatized with high level of uric acid. Slowly it is increasing. Like you have seen in some movies, the villains taking snake poison in slow manner, a small amount, and then he become the poison man. No poison can kill him. It's like the same story. It's called chronic state. Kire, সাবধানি নাকি? ঘুমাচ্ছিস, পড়ে গেছিস? ঘুমাচ্ছিস, পড়ে গেছিস? ঠিক আছে। ব্যথা পাচ্ছি তো বাবা? ব্যথা পাচ্ছি তো? Are you hurt? Thank God. Acha. What else in the story you find? It is genetic. See, his grandfather, father, all had the same problem. That means it's a familial case. The familial history can be seen. See, few days later, the condition had resolved and allopurinol had been stopped. That means what? This is a acute case. Being a chronic case, you must continue allopurinol along with uricosuric agent. Fine. Now we come to the next disease. This Lesch-Nyhan disease, Lesch-Nyhan syndrome, is best characterized by the symptom of self-mutilation. Wherever in any clinical case in your examination, you find there is a symptom given in the question of self-mutilation or biting himself or herself, the patient complaining, biting his fingers, biting his arm. That means it is a sign of self-mutilation. না নিজেকে নিজে কামড়াচ্ছে, এরকম নিজেকে নিজে অন্যকে কামড়াবে না, it's not rabies. He will bite himself. ঠিক আছে? So if you find like this, just try to find out, is there anything related to uric acid in that question? Has it shown any uric acid related symptoms? They might not give the elevated value of uric acid in the question, because that you will ask to examine, right? The question will come with the symptom of self-mutilating symptoms complaint, and joint pains, correct? All these things. And they will ask you what would you prescribe, further examination, and what will be your provisional diagnosis. So your first thing will be to check out what? Serum uric acid level. Number one, write down. Serum uric acid level. What do you, when a patient comes like this, what would you prescribe? What test would you ask for? Number one, serum uric acid level. Number two, kidney function test. Renal function. You have to rule out the kidney dysfunction. Correct? And obviously in kidney function test, sodium and potassium will come. Urea, uric acid, creatinine, sodium, potassium. So in kidney function test, from kidney function you will come to know whether the kidney is functioning well or not. If it is not functioning well, then that is due to accumulation, due to chronic renal failure. So it may not be Lesch-Nyhan syndrome. It may be due to accumulation of uric acid. Right? But in this case, Lesch-Nyhan syndrome, you will find the kidney functioning well. Understood? Kidney will be normal, kidney function test. But still, the person will show neuropsychiatric disorders. So there, your provisional diagnosis will be Lesch-Nyhan syndrome. Okay. How would you confirm it is due to Lesch-Nyhan syndrome? You have to measure HGPRTase activity. Number one, and number two, genetic analysis. Two tests, HGPRTase activity and genetic analysis. No genetic disorder আছে কিনা, মানে genetic abnormality আছে কিনা, aberrations বলা হয়। 24-hour urine test কি মাপা হয়? ইউরিক অ্যাসিড কন্টেন্ট মাপা হয়। কত ইউরিন এক্সক্রিশন হচ্ছে 24-hour ইউরিনে, ইউরিক অ্যাসিড এক্সক্রিশন হচ্ছে কতটা। আচ্ছা, see this line. Does this line signifies the age of patient? Correct? So if a patient comes in the middle of 30s, will there be any, will your diagnosis will be first choice will be Lesch-Nyhan syndrome? If a patient in toddler state, then yes, first choice will be Lesch-Nyhan syndrome. Yeah, see? Because if it is genetic disorder, definitely there are different stages of Lesch-Nyhan syndrome. Some may be more severe than the others. So they will appear more early in this early stage in their life. So those who are little less severe, so they will arrive say around 13, 15 years of age. By 20, this will 20, 21, 25, everything, all sorts of Lesch-Nyhan syndrome will appear. Not beyond that. Like college-going girls, boys, they often come with the syndrome. People think that they have been possessed by some supernatural power. Yeah? They treat them like that in villages, but they are actually suffering from previous one or this one. Right? Orotic aciduria. The only disease you will study from purine pathway, purine biochemical pathway. If you remember the purine biochemical pathway, there is dihydroorotase, one enzyme is there. So orotic acid is excreted in case of any defect in pyrimidine biosynthetic pathway. Very simple, you treat with uridine and cytidine and you find orotic acid in the urine. Now there are three major drugs as antifolate agents: methotrexate, amitriptyline or aminopterin, and trimethoprim. Okay. Now these drugs, they inhibit dihydrofolate reductase step and thereby breaks the regeneration of folic acid in the body. So body suffers from a secondary deficiency of folic acid, which leads to decreased production of other folic acid derivatives which are required for biosynthesis of purine and pyrimidine nucleotides. In absence of purine and pyrimidine nucleotides, the rapidly growing cells, mainly cancerous cells, they succumb to death. What happens here? Because they need more and more nucleic acid, so they succumb first to death due to unavailability of nucleic acids. But the problem is there are many other cells in our body which also grow very rapidly. Say for example, hair follicular cells and blood producing cells. So these two tissues are also affected by this drug. That is why chemotherapy leads to temporary baldness as well as indigestion problem. They cannot absorb because mucosal cells of the gut are rapidly generated. They are also affected. So they cannot absorb food. So they have to be given vitamins, minerals through IV because they cannot absorb from the gut. This is called celiac sprue. They develop a condition called celiac sprue. Right? And they cannot absorb from the gut. Dihydrofolate reductase, this step is affected. Now, ADA, adenosine deaminase. As I told, this was the first enzyme which was targeted for gene therapy. Nowadays, gene therapy is obsolete. We do not look back again and we do not read again. What is obsolete? We do not read. So, make sure that no question will come from gene therapy. Okay. Only thing is, yes, you have to remember this one. What is SCID? Severe combined immunodeficiency. That is due to deficiency of ADA, adenosine deaminase. Adenosine deaminase. What happens here? It kills selectively lymphocytes, both B and T cells. That means what? Your immune response is very low, just like AIDS patient. Just like AIDS patient, but this is not by some virus, this is due to your genetic disorder. এটা পড়া এত দরকার নেই, লাগবে না, এটা লিখে রাখবো। Very active in deoxyribonucleic phosphorylation. লিম্ফয়েড টিস্যু, এটা কাজে লাগবে। What is PEG ADA? PEG. What is PEG? কি বল? কি বল? হ্যাঁ বল, PEG মানে কি? জীবনে পেগ করা শুনিস নি? হ্যাঁ আসছে বুঝো, তুই বল। হ্যাঁ ভেরি গুড, জানিস যখন কায়দা মারছিস কেন? বস। পলিইথিলিন গ্লাইকল, বসো বসো। পলিথিন গ্লাইকল বিড পেগ বিডের সঙ্গে অ্যাডাকে মিশিয়ে টিস্যুর সঙ্গে দিয়ে দেওয়া হয়, এতে কাজ হলে ভালো। অ্যাক্টিভিটি লাস্ট ফর 1 to 2 weeks। কেন জেনেটিক জিন থেরাপি কেন করা হয় না? জিন থেরাপি করতে গিয়ে দেখা গেছে প্রথমে সমস্যা কি হচ্ছে, ওরা প্রথমে কি করছে, what they did, they replaced the portion of DNA which produced ADA. But problem is that generated insertional mutation. So patient survived of ADA but died due to cancer. Patient was I think 7-year or 8-year-old girl whose father actually made the discovery of gene therapy to save his daughter. And the girl is to be kept, I forgot those names and everything, like in a customized made chamber with all plastics and everything, no external air would come because no virus, no bacteria free air should be always circulated inside, so that she doesn't suffer from any even common cold. For the most deadly was for her common cold. One sneeze means she will die because she has zero immunity. Okay, so her father made like this. Anyway, she survived for some years, but then they died due to insertional mutation. So by this you can continue the lifespan for some time. That's all. Any questions so far? Long question, clinically oriented question you may expect from gout. Classification of gout. What is acute condition of gout? What is chronic condition of gout? Treatment of gout. 2 types of treatment. One is targeting the xanthine oxidase. Another is uricosuric agent. Name some uricosuric agents like this. Then what are antifolate agents? What are their role as anti-cancer drug? Right? Then HGPRTS deficiency manifestation. What is that? Lesch-Nyhan syndrome. Right? Achha. What else? That's all. Almost everything I have explained in the class. If you have any question, ask me now or later. Any question? Any doubt? Purine? Autism? Purine যদি accumulate হয়, nucleic acid যদি accumulated হয় ব্রেনে, তাহলে এটা purine autism it may lead to purine autism. অটিস্টিক হতে পারে। একটা ডিএনএ যদি তৈরি না হয় সেলের ভিতরে, তাহলে সেটা অটিজমের কোনো একটা কারণ হয় না, বিভিন্ন কারণ হতে পারে। একটা হোল ক্রোমোজোম মিসিং থাকতে পারে, পার্ট ক্রোমোজোম মিসিং থাকতে পারে। ক্রোমোজোম ঠিক আছে, প্রোডাক্ট হচ্ছে না হতে পারে। প্রোডাক্ট ঠিক আছে, ব্রেনের শেপটা ঠিক হয়নি বলে কাজ করছে না। অটিজমের বিভিন্ন কারণ হতে পারে, কোনো একটা কারণ হতে পারে, তাই না? দেখা গেছে যে এই অটিজমের কিছু কারণের মধ্যে পিউরিনের মেটাবলিজম ডিফেক্টও আছে। জিন থেরাপি করার জন্য ওই যে বললাম না পলিইথিলিন গ্লাইকল বিড পেগের পলিইথিলিন গ্লাইকল হচ্ছে একটা সাবস্টেন্স যেটা দিলে ওই সেল মেমব্রেনটা পোরাস হয়ে যায়। ইন প্রেজেন্স অফ পলিইথিলিন গ্লাইকল সেল মেমব্রেন বিকাম পোরাস থ্রু হুইচ ইউ ক্যান ইনসার্ট জেনেটিক মেটেরিয়াল। বুঝতে পেরেছি? তাহলে জেনেটিক মেটেরিয়াল মানে ডিএনএ ঢুকে গেল, ছোট্ট একটা ডিএনএ ঢুকিয়ে দিলি যার মধ্যে একটা জিন আছে। ওই জিনটা ভিতরে কি করলো, কি সেলের ভিতরে গিয়ে একটা প্লাজমিডের মতন সার্কুলার ডিএনএ তৈরি করলো। হিউম্যান সেলের ভিতরে প্লাজমিডের সার্কুলার ডিএনএ তৈরি করলো, দিয়ে সেখান থেকে অ্যাডা তৈরি করা শুরু করলো। কারণ মেইন জিনোমিক ডিএনএ থেকে অ্যাডা তৈরি হচ্ছে না, অ্যাডিনোসিন ডিএনএ তৈরি হচ্ছে না। প্লাসে যে প্লাজমিডের মতন তৈরি হলো সেখান থেকে তৈরি হবে, এইটা ছিল যে কনসেপ্ট। কিন্তু এইটা করতেই দেখা গেল অনেক সময় ওটা ওর সঙ্গে ঢুকে গিয়ে হাইব্রিডাইজ করে গিয়ে মেইন জেনেটিক মেটেরিয়ালের সঙ্গে হাইব্রিডাইজ করে গিয়ে ইনসার্শনাল মিউটেশন হয়ে গেল। তাহলে কি ফ্রেমশিপ মিউটেশন হয়ে গেল, কোনো একটা পার্টিকুলার এনজাইম বন্ধ হয়ে গেল। বেশিরভাগ দেখা যায় যে স্কিন ক্যান্সারে এফেক্ট করে, সেই জন্য পরবর্তীকালে জিন থেরাপি ব্যান করে দেওয়া হয়। কারণ এটার আউটকাম সম্বন্ধে আমরা সার্টেন নই কি আসবে। ওয়ান অফ দি এফেক্ট ইজ গুড এফেক্ট, but most of the effects are bad effect. কোনটা বাবা? সোডিয়াম, হ্যাঁ, সোডিয়াম ইউরেট ক্রিস্টালস গুলো বডির থেকে দূরে, মানে কোর অফ দ্য বডি থেকে দূরে প্রেসিপিটেট করে। কেন? তার কারণ টেম্পারেচারটা কম থাকে, এই সলিবিলিটি জলে কম, টেম্পারেচার কমলে কি হবে, ওটাকে প্রেসিপিটেট করে, তো সলিবিলিটি কমে। তাহলে আমার যে ফ্যারাঞ্জিয়াল জয়েন্ট বা মেটাটার্সাল জয়েন্ট, সেগুলি আমার কোর বডি থেকে অনেকটা দূরে, সেইখানে এটা বেশি হয়। আবার কি হয়, সোয়েলিং অফ দি এক্সট্রিমিটিস হয়, মানে আমি অনেকক্ষণ হাত ঝুলিয়ে আছি, হাত ফুলে যাবে, অনেকক্ষণ পা ঝুলিয়ে বসতাম, পা ফুলে যাবে, তো দেখে মনে হবে যেন এটা কার্ডিয়াক প্রসেসের গন্ডগোল যেন হচ্ছে, কিন্তু তা না, বলা যায় ওটা ইউরিক অ্যাসিডের জন্য। গাউটের একটা কারণ কিন্তু ওইটাও একটা সিমটম, যে অনেকক্ষণ বসে থাকলে পা ফুলে যাচ্ছে, তার জন্য ওদের একটা কি বলা হয় যে বালিশ বা কিছুর উপরে পাটাকে উঁচু করে রাখতে হয়, যাতে বাই ডিউ টু গ্র্যাভিটেশন ওটা নিচে থাকে ফ্লুইডটা।